Namaskar parents, I am Dr. Dipesh Prajapati, dentist just for kids from Jaipur, Rajasthan. Today in this video I am to talk about what special considerations to be taken if your child has been diagnosed with autism spectrum disorder or autism. First of all, first thing, foremost thing, most important thing I want to convey through this video is that if your child is very aggressive, doesn't make eye contact, has speech delay, is very hyperactive, doesn't respond to their own name, has a lot of screen time, and your pediatrician is trying to give you a special recommendation to visit a developmental pediatrician or a pediatric neurologist, please do not avoid this appointment. Please accept that your child needs special help and needs special therapies. I have often seen that parents ignore such mistakes, fearing that there will be a social taboo and your child will be diagnosed with one or the other thing. But trust me, as young as 2 years of kids, developmental pediatrician can suspect things and can start appropriate therapies, and if appropriate therapies are started, it can help immensely to the kid in becoming close to normal individual. And if therapies are delayed and if therapies are started late in life, their duration and their effect is much more less. In autistic kids, we have to understand their sensation is very strong, so dental instruments like cold mouth mirror or voice of a dental drill, they can assume it as a pain, so dental treatment goes very slow with these kids. We have to adapt, we have to make them acceptable, we have to make them comfortable with the new sensation of the dental environment. So please understand the dental treatment of autistic kids goes very slow compared to other kids. If other kid can get that same dental treatment in 3 or 4 visits, an autistic child might need 7, 8 or maybe 10 visits. So consulting a specialist dentist who are pediatric dentists, who are trained, who reads, who follow the research on autistic kids, are the best person to consult for dental issues of autism. One more thing, if your child has been diagnosed with autism, please start immediately with preventive dental visits to your pediatric dentist. Do not wait for something pain or big cavity to be seen and then take an autistic child to a dentist, because then the dental treatment becomes very complicated and we often have to put the child to general anesthesia, which increases the cost of the treatment and risk for the child as well. So my recommendation is start visiting a dentist for preventive things without any dental problems which you can see or diagnose. Following preventive dental follow-ups with the pediatric dentist, we can keep the dental problems of an autistic child to minimum and probably can avoid general anesthesia exposures to the same child. Regarding appointment scheduling, my advice is it is always beneficial to keep the first appointment in the morning for the autistic child, because the child is also fresh, the dental team is also fresh, they can give more energy and patience to the child. So always request a first appointment with your dentist. If there is some waiting period in the dental office, it's always advisable that the child waits in his or her car, parents' car, so that the new environment of the dental reception doesn't affect the child. These child have lot of oral aversions, so the brushing becomes a big problem for the parents. So please do not avoid brushing. Consult your pediatric dentist. He might refer you to a therapist which can help you or the child accept the brush in their oral cavity and can help parents to brush the child teeth well. Remember, these kids are often on sweet and not so solid liquid diet, so it is already make them more prone to cavities. So we have to brush twice a day for autistic child, even it is difficult. If you have doubt on the same topic which we have discussed in this video, you can drop your doubt or your question in the comment section below or on the email ID given above. I will definitely reply and try to help. Dhanyavad.